Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about bruxism at large. Let's start. So this is a very important episode. I might have come up with previous episodes of bruxism, but as we talk about, once we start getting experiences around patients, we've come to know that bruxism is actually a very big topic that needs to be deep dived into. Now, when we talk about bruxism, it can be broadly classified into awake bruxism and sleep bruxism. Awake bruxism is basically when you are consciously gnashing, grinding or clenching your teeth, and you usually self-report them with the help of a questionnaire or otherwise. Now, awake bruxism is very simple, that especially when there is an increase in the stress, sometimes the workload or sometimes the work that requires you to concentrate. For example, your study, when I have to edit the videos, especially if it's a very specific amount of time stamp, and I know that there is a specific point of time where I have to actually edit and splice the video, it happens so much and so many times that I end up gnashing my teeth just to get the thing right. Now, I get this very sporadically, but there are a lot of people who do this very frequently and they have complaints such as wearing of teeth, pain in the masticatory muscles, fatigue, at the same time a lot of feeling that the bite has kind of changed over a period of time. Now, coming to the bigger giant or the elephant in the room, which is sleep bruxism. Sleep bruxism, I was not aware of the fact that this is such a common thing, and approximately 20% of the population might be suffering from it, and most of it is actually females. Now, sleep bruxism is actually a huge deep ocean of things that need to be discussed, assessed and evaluated when it comes to a patient. So what are the symptoms of sleep bruxism? Usually the sleep bruxism is actually reported by a partner of the patient, who reports that there are some sort of gnashing sounds that come, some sort of breathing difficulties that might be there, especially with patients who snore or have obstructive sleep apnea. And on top of that, they might feel that there is some tenderness in the masticatory muscles in the morning, their jaw feels misaligned, they get pain in the TMJ, and on top of that they get other symptoms such as daytime sleepiness, cognitive difficulties and even mood swings. The other way to confirm sleep bruxism is to get polysomnographic findings done, and it could have association with different forms of other sleep disorders as well, such as obstructive sleep apnea, snoring and other things. Now, sleep bruxism can actually be primary, that means there is no other ascribable disorder to it, or it could be secondary to any other neurological disorder or any drugs that you've been taking for any other particular disorders. And on top of that, you have to understand that the detection requires there's a lot of criteria for detection. One is a reported questionnaire with the help of a partner. You might have bruxing episodes which occur over 2 or 3 times consecutively in a week. Polysomnography tests that have been corroborated that bruxing episodes have happened, and that there is something known as other things such as rhythmic masticatory muscle activity, which is basically how your masticatory activity goes into bursts of increase in bursts of the activity. Now, a lot of people might say that this is just a consequence of stress. Not necessarily. It is actually a CNS, a central nervous mediated response, and it is quite often sometimes complicated with other things, as I've already mentioned, such as snoring and obstructive sleep apnea. Usually it is a protective response that has been seen because of the fact that when I went to the books and I went to the literature in detail, it is an SNS mediated response. It's a sympathetic nervous system mediated response, wherein a fight or flight response, that is your body undergoes some sort of stress. Usually this is associated when the body undergoes hypoxia. Now, hypoxia is basically the lack of oxygen in your body and tissues because of various reasons. It could be because of snoring, that could lead to micro arousals. It could be because of obstructive sleep apnea, where your muscles undergo relaxation, the tongue falls back, the pharyngeal wall kind of collapses, and that's where the aperture of air that goes inside your lungs through your mouth kind of becomes smaller, and that's why there is not enough oxygen. Your saturation goes down by more than 4% and you get a sleep arousal. Now what happens because of the hypoxia? The body signals the brain and the spinal cord and the medulla oblongata that there is not enough oxygen. So the medulla oblongata and other things in the central nervous system, they will create a stress like situation where it will in a snap send signals to the brain. The brain might release signals such as catecholamines, and that might stimulate the muscle activity here. On top of that, the SNS kind of creates this kind of a rhythmic bruxism activity, because of which there is lubrication inside the oropharyngeal space, and because of the lubrication and because of the activation of the muscles, the atonia, rather than the atonia means that the muscles are not responding to any sort of stimulation, or they are not toned. The increase in the activity kind of activates the muscles, and again the aperture becomes big, apart from the fact that the patient might get sleep arousals, and then you go into a parasympathetic nervous system mediated stage. So it's kind of a protective response. However, in the long term, it has caused a lot of problems to a lot of people, such as, because if you're not sleeping well, now the whole in the pop culture and today's podcast culture also, you can see that everyone's talking about the mental health or gut health related to sleep. So everything is related to sleep. That's why sleep bruxism is a very important thing that needs to be taken care of. Now, when it comes to the examination, we've already talked about the signs and symptoms. What can be done? The first thing that you need to do, if you feel that you or your partner have sleep bruxism and you have all the aforesaid mentioned symptoms, you need to visit a dentist who knows about bruxism, and then they might evaluate you and see if they can see any wear facets, any sort of pain, or very tender muscles of mastication that can be palpated. On top of that, when you see that you do eccentric bruxism, you get a very typical pattern of cervical abfractions. Now you must have heard of cervical abrasions that are caused by forceful and very hard brushing. Something known as cervical abfractions is because of the flexures that happened at the tooth root junction. The abfractions happen, and what happens is that the enamel here, it kind of breaks off. It might get disease because of cavitation and decay and accumulation of bacteria. But in very severe bruxes, you can see this, that they will have a lot of cervical abfractions present, those kind of hollowed out kind of cracks or microfractures you might be able to see. So that's something very important. On top of that, we would strongly recommend that you get a polysomnography test to see if you have any other things such as obstructive sleep apnea. If you have very severe sleep apnea, I would strongly recommend, please go to a sleep specialist to either get yourself evaluated for a CPAP or a BiPAP machine, or even a mandibular advancement device with the help of your dentist. And if you can get orthotic appliances for your bruxing, that will also help in breaking the sleep bruxism cycle, and it's going to cause a lot of relief at least in the first few weeks, which over a long period of time might come to baseline, and that needs to be adjusted. So you have to really understand that there are a lot of other things, and apart from that, if at all you have to undergo some sort of sleep hygiene measures, that while before sleeping, please don't take enough don't take heavy alcohol consumption, or smoke a lot of cigarettes, or smoke in fact that matter. Don't take caffeine, don't use a lot of screens with blue light, so that your whole body is undergoing that stress response that you need to sleep and your body is still awake. That's very important. And if at all you require any sort of pharmacological intervention, your dentist and your sleep physician might be able to help you out with some sort of drugs. Let's not get into the drug aspect. We can do a lot of other things, as I've already told before. Once you improve your sleep quality, your whole quality of life will improve, your mood will improve. You'll probably be able to get better or get up earlier than usual. You'll be able to feel better. You won't get daytime sleepiness. You might be able to shed that stubborn weight that you were trying to lose, because of the fact that your metabolism and your basal metabolic rate might also shoot up to better levels. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's causing you discomfort, and drop me a message on WhatsApp. In a couple of days, I'll reply to it. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.